All right, the number one biggest mistake that physical therapists right now are doing as it relates to remote therapeutic monitoring. That's what we're going to talk about in today's video. My name is Dr. Andrew Gorecki, physical therapist, owner of MovementRX, the best remote therapeutic monitoring platform that's out there. All right, so what is the number one biggest mistake? The number one biggest mistake that I'm seeing right now is that practices will adopt a digital home exercise program, right? A software that has RTM or remote therapeutic monitoring capabilities. It will track time and it will populate the codes automatically, things like that, right? That's great. And what they're doing is most clinics are producing the codes that are designed to reimburse you for the patient having the technology. So there's the 98975 CPT code that is like a one-time code, roughly around $17 of reimbursement. And that code is really a setup. It's like you setting up and educating the patient on how to use their digital HCP. The second code is the CPT code is a 98977. That is a device, them essentially having the device access to it each month, right? So it's about $50. So I see clinics producing those codes, right? They put the person in the system automatically generates those codes over time. Well, that's great, right? However, 99% of the clinics that I'm working with are not actually monitoring the patient. They're not producing the code 98980 or 98981. Now, the problem with that is first of all, you're missing out on about three-quarters of the revenue that's there. You are not holding your patients accountable, so you're not doing the required monthly phone call. You're not actually monitoring their activity. So you're not holding them accountable. They're not improving their, exercise compliance, and their outcomes aren't improving. So it's not going to move the needle on your MIP score. But more importantly, I would argue that it's not compliant. Right? Medicare doesn't want you to just generate tech codes. They want you to actually monitor and hold your patients accountable. So I believe we'll look back, and that's the number one biggest mistake that practice owners are making. So that's where I come in. Movement RX, we do the monitoring for you, so you don't have to. Right? You're busy. We hire and have remote providers around the country that actually do the monitoring time for you. If you're interested about hearing more, just let me know. Thanks.